It's now time for the part of the lecture where I scare you into not doing methamphetamine. Woo! So amphetamines in general has a very large potential for abuse, and abuse of amphetamines can have a very long-lasting effect. So prolonged using amphetamines for a long time can lead to psychosis, including hallucinations and paranoia that look just like schizophrenia. It can occur outside of intoxication in chronic users. So whereas in cocaine, we only saw psychosis during cocaine use, with amphetamines, you can have psychotic episodes outside of use. So even if you are not intoxicated, you can still have a psychotic episode due to your amphetamine use. So in animals, when we give them methamphetamine doses for a long period of time, it actually results in long-term damage of a decreased dopamine in the brain, decreased tyrosine hydrolase, and decreased DAT in the striatum. And so histology of these brains shows degeneration of the dopamine fibers after chronic methamphetamine use. We also see damage to serotonin fibers in our neocortex, the hippocampus, and the striatum. So this image is just showing we've got a control subject here, a meth abuser here. This is a PET scan of a ligand that binds for DAT. So chronic methamphetamine users, after 80 days of detox, show a persistent decrease in DAT. Okay, so this is how much loss. So here there's not much loss, and here you can see there's more loss of DAT. Okay. So even when they stop using meth, they still have a loss of DAT. Now this is an image, again, showing the decreases in DAT. So this time, more color is more DAT. Here, we're looking at it in the striatum of a control subject. You can see there's a good amount of DAT. Here's with methamphetamine, definitely less. And then here's methcathinone, which is a synthetic derivative of cathinone. So that African herb called cat or hat. Again, I'm very sorry if I'm pronouncing that wrong. And then we're comparing it to a patient that has Parkinson's disease. So with Parkinson's disease, we see a natural decrease in dopamine fibers and in DAT receptors and transporters. So we're seeing that methamphetamine and methcathinone can lead to a decrease similar to PD patients. There's obviously some major adverse effects of methamphetamines. So here we've got the classic example pictures of people. It's called Faces of Meth. And so these are the before pictures of people that were early on arrested for methamphetamine use, so they haven't been using it long. And then after just a few months, so this is just 3 months later, people's appearances have declined significantly. And what we're seeing on both of these patients is formication. So we see an increase of scabs on their face where they're constantly picking and scratching their faces because they feel like there's bugs on or under their skin. And they have that hallucinations with psychosis that can lead them to kind of self-harm, and it can lead to damage of their physical appearance, leading to these scabs that we see here. Now, other than that, we also see that meth users will have very degraded tooth enamel, and that's because crystal meth is very acidic, so it will actually eat away at your teeth, especially when smoked. So the picture here is what's called meth mouth, something that we see with a lot of addicts that smoke crystal meth, where the meth is eating away at their teeth. Now, this can be exacerbated by our sympathomimetic and stereotyped effects. So decreased salivation because our sympathetic nervous system is on. We see dehydration because of our sympathetic nervous system is on. So we don't have time to stop and drink and eat and all that. That could actually help rinse away some of the meth that's sitting on our teeth and eating it away. We also see those stereotyped behaviors, so such as teeth grinding, and that can also lead to this meth mouth where your teeth are already a little fragile, and now by grinding them, they're more sensitive to damage. So we also just see in general reduced self-care and heavy abusers, again possibly because of the sympathomimetic effects and stereotypic effects that amphetamines have. Now, there are, of course, some clinical uses of amphetamine. We do use amphetamines in a clinical setting. So other than, like I talked about, Sudafed is a great decongestant that's used. There's also other amphetamines that we actually use for other things. So some that you've probably heard of, if you haven't, don't know where you've been, but amphetamine itself, the drug Adderall is amphetamine. That's just what it is. There's also methylphenidate, which is Ritalin. So that is also a kind of type of amphetamine. And both of these amphetamines are the most common treatments for attention deficit hyperactivity disorder, so ADHD. Now, again, I mentioned like Sudafed and stuff, so that's pseudoephedrine, and so that's a decongestant. Now, we do use pseudoephedrine sometimes as a treatment for narcolepsy because it is a stimulant, so it'll prevent patients from falling asleep. Amphetamines that are used to treat ADHD have a potential for abuse, so people that don't have ADHD or ADD and take these drugs, again, they're experiencing the stimulant effects, the effects that let them kind of hyper-focus, the effects where they don't need to eat or drink or go to the bathroom so they can just sit and study and focus all the time. And so we see abuse of these drugs in student populations a lot. Now, these widely used illicit drugs, when used illicitly, then we call it nootropic drugs. So these are the drugs that are used in the university students to improve studying. So Adderall and Ritalin, when used illicitly, then we call them nootropic drugs. Now, obviously, these drugs were developed to treat attention deficit disorder or attention deficit hyperactivity disorder. So what is ADHD? So ADHD is characterized by increased locomotor activity and distractibility. So it's an inattentive subtype, is characterized by extreme difficulty in sustained attention. There's an impulse hyperactivity subtype, which is characterized by high impulsivity and excessive motor activity. And then there's combined subtypes that incorporate both inattentiveness and impulsive hyperactivity. So you're probably asking, how does a psychomotor stimulant treat ADHD? Shouldn't a stimulant, wouldn't you think like a depressant or something like an opiate would be better to treat this? Because these patients have excess motor activity. They don't need more motor activity, which when you activate the sympathetic nervous system, you're usually activating motor activity, right? So how does that work? Well, it turns out ADHD is actually dominated by an attentional deficit. So, and the hyperactivity is actually like a side effect from the distractibility. So because they're easily distractible, because they don't have the attention, then they are able to do this hyperactivity, or this hyperactivity comes from that. So what these psychomotor stimulants do is they're actually treating the attention deficit. So it's thought that ADHD may actually occur through excessive DAT activity, which results in not enough dopamine in the synapse. And since we know our amphetamines result in more dopamine in the synapse, then that would be a possible reason why these drugs work to treat ADHD. Now, we also see that DAT density does increase in ADHD adults. And genetic evidence links some cases with a polymorphism in the DAT gene, and so there may be a genetic link to ADHD. But again, by treating with amphetamines, then we're targeting the DAT itself. So we're targeting the problem at the transporter that seems to be leading to these issues.